I think we are live. All right. Good afternoon, everyone. So as I promised, I was going to be back in 10 minutes, and here I am. My name is Kemal. I'm the chairman of American Surgery Center. Today is our another Bariatric Friday event with Dr. Irgau. Dr. Irgau, how are you doing?
Very well, Kemal. Good to see you again on Bariatric Friday. Hello, everybody. I'm Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery, and my specialty is weight loss surgery or bariatric surgery, which I have been doing now for about 20 years. And with my associates at CHRIAS, we're by far the most experienced group in bariatric surgery in our area.
So, Dr. Irgau, today you had a busy day before this event.
I did lots of surgeries at our surgery center as well as the hospital, but everything went well, everybody is safe, and I made it on time for our Bariatric Friday.
I'm glad you're here. So we are going to cover another topic today for our patient population, people who are struggling with morbid obesity. And I do want to actually just introduce our other surgeons in the program so that everyone is covered. Dr. Irgau, everyone already knows because he's always with me on these events. Dr. Gail, she's one of the most experienced female surgeon in the United States and probably therefore in the world. So Dr. Michael Peters and Dr. Rahul Singh and Dr. George Ibrahim are other bariatric surgeons, and then we have Dr. Sachin Maid, part of the colorectal program that we have running parallel with our accountable care organization. So today we actually I should mention our registered events, registered dietitian. There's one additional person that we have, Ms. Scott, who joined us 2 weeks or 3 weeks ago. So her picture should be updated on here. Now, what I would like to do, Dr. Irgau, so that we can start the session. So you and I, we are actually trying to do this event every week, and part of our goal is we want to actually break the morbid obesity and the bariatric surgery process into several different steps, different topics, so that we can actually make this a small, short event for our patients to kind of just pick on different ones, and then they can just watch one full topic, and then while they're going through the process, or even after they go through the process, they can actually learn different things from here. Now, finding different topics is always what people may be struggling with. Just like, it's one of the things that I always say, that it's not about just the specific population. This is the issue for everyone. Everyone in the maybe same age group, same gender, same social backgrounds, they're having these issues that we are discussing. The only problem is when it's with the morbid obesity, those complications or the difficulties is like ×5, ×10 in some cases. So nothing we discuss, none of the topic is just for this group of patients. So that's kind of important because, look, I mean, I have to, like tonight we have an event, our holiday party. I have boiled eggs at home because before I go out, I don't want to eat in those types of parties. So I'm just going to have egg whites. So, and I don't think I'm morbidly obese. So this is a struggle I have to plan. So it's like 3 p.m. and this is a 7 p.m. event. I have to do that for a couple of different reasons. One, I don't want to eat something that I don't want to I'm not maybe used to because I have sensitive stomach, right? So I don't want to eat, but I do want to have something. If I have a couple of drinks, then I have some protein on the in the stomach. So then I don't want to be too hungry when I get home, right? Yep. So this is a day-to-day struggle that we deal with. So everyone has similar issues. Now, people who are not taking these maybe precautions in their lives, then they may deal with more severe issues. So giving all this background, I'm trying to prep us for our new, not new topic, we discussed this one. One of the really important benefits of bariatric surgery is sexual health. And so we did cover this once, but I think it's important enough for us to go over this. And we are going to repeat these events anyway. So Dr. Irgau, tell us about the obesity and sexual functioning, why it's more difficult or more crucial for this group when you have a morbid obesity, when you are someone who's dealing with morbid obesity, what's happening on the sexual functioning side?
Absolutely. So as we have said in many other sessions, Kemal, there is practically no aspect of one's health that is not affected by morbid obesity, right? And morbid obesity tends to affect many aspects of the individual's health in a detrimental fashion, and sexual health is not an exception to that. So as you're showing here, essentially, there have been studies that have shown that the higher the weight of a person, particularly in the morbid obesity range, then there are impairments in the sexual function and sexual quality of life that patients have reported, right? And this has been shown not only in men, but also in women. And a study by Dalal, who's actually a bariatric surgeon, is mentioned here, where they have reported, for example, that up to 60% of women who are seeking bariatric surgery have reported sexual dysfunction. So there are problems inherent to the presence of excess fat in our body and the hormonal changes that it brings that affect sexual function, but also there is the psychological aspect to it as well, right? And both these two factors have an impact on the sexual health of the person. And the result is that the longer a person has struggled with morbid obesity, the more likely it is that they will report that they have struggled in their sexual health as well. And as I said, this affects both men and women, right? And these are other...
it impacts them in a different way though, right, Dr. Irgau?
Yeah, absolutely, absolutely. So if it's in terms of, hormonal situation, for instance, there are problems with erectile dysfunction that men report. Whether if it's in a psychological realm, there is a person who is morbidly obese is less likely to have had what anybody would call a normal sexual life in the past 12 months or 2 years, depending on when the survey was taken, essentially. And as I said, this has an organic hormonal reason, because the increased presence of fat leads to that, but also there is the psychological aspect as well, because you have to be psychologically comfortable. The mental health has to be in the right state for a person to have obviously a good, healthy relationship with others as well.
So this, Dr. Irgau, this came out, I believe, if I'm not mistaken, a couple of years ago.
Yeah, absolutely. So essentially, it goes to what I was just saying. For instance, this study is showing that obese women were less likely than normal weight women to report having a sexual partner in the previous 12 months, right? Obese men were less likely than normal weight men to report more than one sexual partner in the same period of time, right? So essentially, this study is concluding that there is a link between the BMI and the sexual behavior and adverse sexual health outcomes, both in men and in women. And it is something, as I say, that has to do not only through the psychological impact that obesity has in terms of self-confidence, in terms of appearance, in terms of presence of potential problems like depression, but also there are hormonal reasons as well that morbid obesity by itself can lead to sexual dysfunction.
So now I think if you if you can actually talk about, let's forget the morbid obesity side for a second, what actually sex does in our life, right? So why it's important to have it, and what other, how it impacts the rest of what we are doing. So, and then that's why, then we can say, here's why this is a problem when you don't do it enough.
Absolutely, absolutely. So the question is, of course, having a healthy sexual life is important, right? It's really impacts the quality of life of the person, not only in terms of their relationship with their partners, but also in general as a person, right? So that deprivation, that inability, that lack of confidence, right, creates by itself emotional problems that are present, that are added to the emotional struggles that morbidly obese patients will have, right? So one of the problems that is seen, for instance, is lack of self-confidence, because people may not be comfortable with their weight. Remember, sexual activity requires total exposure of who you are, right? Of your body. If you're not comfortable with how you look, how you feel with your body, you are less likely then to be comfortable in that situation, right? So that is not a minor problem. That is actually a serious problem, and it's not unusual for me actually to meet many patients and I will be asking them, for instance, and I will casually, not necessarily inquiring about their sexual life, but I will be asking them, for instance, if they are taking birth control pills, because I'm preparing them for surgery, and it's important to stop birth control pills for surgery. And it's not uncommon for many women to say, you know what, I haven't had any sexual life for so many years. My life has not been that great. And that is something that comes out as, almost they've given up as something that they cannot have just because they've been struggling with morbid obesity. And that's a shame. On the other hand, Kemal, once people lose weight and they become very confident in themselves, in their appearance, other aspects of their life thrive as well, and that is, their sexual health as well.
So, the part of, as you mentioned, like what it is with the dysfunction, what it does for the person, and when you don't do it, what you may be missing out, and then later on it becomes the contributor to the other chronic problems that we have. Like actually, one of them is probably depression, right? So when the sex is not there, the depression is highly likely to be there. And it's so interesting that depression is related to other stuff, like such as when A1C is not controlled, depression comes out. So depression always comes out in some way. And then, with the not getting rid of the morbid obesity, it actually takes different things from our lives. And then one is the functionality of the sex, and then with that, the benefit of what you are having.
Absolutely, absolutely. So there is no question, Kemal, there is no question that there is a relationship between a good quality of life and satisfaction in one's sexual life. There is no question about that, right? So the issue is, how does deprivation impact a person? And how is that deprivation happening, particularly when people are morbidly obese, right? And as we say, there are two aspects to it. Organically, there may be there are hormonal changes that actually may decrease the drive, right? The sexual drive, the sexual function itself, right? And on top of that, obviously, there is the issue of confidence, right? To be self-confident, to expose yourself and feel confident that there will be appreciation of your own body. If that confidence is not there because people don't feel comfortable with their appearance, then they are less likely to have a healthy sexual life as well. So the impact is two ways, essentially. It's very interesting, Kemal, to see that, this the way obesity affects sexual health. For instance, you could see it in women in menopause or perimenopausal years, right? Where there is not, particularly when they're struggling with obesity, not only there is an impact on their sexual life because of the changes that happen at that time, but also there appears to be a relationship between perimenopausal years and increase in weight or more struggles with weight. And it's not uncommon, for instance, for women to report that they've gained a lot of weight since they went through their perimenopausal years, right? So there is this complex interaction between excess fat accumulation in our body and many aspects of our health, including sexual health.
Absolutely, and one of the other things that I want to share, Dr. Irgau, here is one is from the personal standpoint, that's personal benefits. But when you are in a relationship, when you are in a marriage, sex becomes part of that. And then I actually borrowed this from this website, and the way that they actually explain why sex matters for marriages is the sexual intimacy and emotional intimacy, right? So this builds trust, this builds connection, and then sexual trust translating to deeper connection, and then there are other health benefits. So now, when you read it this way, you're like, okay, so let's try to help more people. So, right, because like it's taking some part of the life away from people. Like
absolutely,
are impacting people's personal relationships, their marriages, their not we are like when you are not actually taking action on these problems, it has deeper impact in our lives, which turns out to be like it comes back as a depression, deeper depression, and then and then you become one miserable person. So if you don't take care of these things, so that's one of the. I mean, that's why we want to kind of bring this up. And one other thing that I do want you to address for us is this was important. This is, I mean, all of them are important, but this is also even more important for our female patients, female population. So the menopause is a big problem already for many people, many women who are going through this. They already have their own issues with it. But I think with the weight gain, this actually does complicate even the menopause. And if you can just give us your take on that.
Yeah, absolutely. So I was just mentioning that, Kemal, that there is actually a weight gain during the perimenopausal years. So what this study is telling us essentially is that there is an average weight gain, right? And during menopause. And that is something that we see that actually in practice, we see it also, because when you ask particularly women at the perimenopausal years, why they're looking for bariatric surgery at this moment, because they will tell you one of the things they have noticed is suddenly I noticed 20 pounds gain, 30 pounds gain. So if they were on the obese range until then, suddenly they are thrust into the morbid obesity range, right? So the perimenopausal years, not only they bring their problems due to the hormonal changes, but also there is much higher struggle with weight. The body seems to be much more inclined to for that person to gain weight as opposed to be at a stable weight in those years. So that's what they're talking about.
So if you are already going into the in a different world, like if you are going into the menopause, then chances of you gaining more weight is it comes with how bad your morbid obesity level is.
Absolutely, absolutely. So if we're starting from obesity, if we're starting from morbid obesity and we're going through those years, it's going to be even worse at that time, essentially, because whatever attempt they do, whether it's with diet, whether it's exercise, is much less likely to lead any results, in those perimenopausal years, as opposed to women at a younger age. And I want to address the issue about, you bringing up this topic today, Kemal. I commend you for that, right? Because this is one of those topics that we don't talk about, right? People suffer in silence about these issues, right? It may be brought up when people are talking to their counselors or their therapists, but in general, it is something that people suffer in silence by themselves, right? And but it is part of the reality of morbid obesity. As I said, one of the reasons people feel liberated, feel really improved in their quality of life after bariatric surgery when they've lost 80 pounds, 100 pounds, 150 pounds, and they feel a very different person, is because there are changes not only in the way they feel about themselves, they look at themselves, but also the intimacy that they have with their partners also improves in that sense, right? Because they are much more confident and they are much more comfortable. And if they are confident and comfortable, the relationship becomes more enjoyable. So it doesn't become a drain. It doesn't become a painful, anxiety eliciting situation, but it becomes something that they look forward to because they are self-confident, essentially. So that's why I think it's a great thing to bring it up. And I doubt that there will be many bariatric talks that talk about this topic, but it's important to talk about it.
My approach with these things, if you don't communicate, then you are not able to find a solution. I always say this in the personal relationships, in the clinical settings. Patients should be telling us what they're going through. People should be telling us what they are going through, not necessarily what they're going through, but if something that's bothering you, we should know, or I should know. If I'm creating that problem, if I'm the root of that problem, if I'm originating that problem. So I look at it just like everything else. So this is people are dealing with different issues. I think the part of the issue that the understanding of maybe the way that I kind of process these things. Like I just want to go through the root, which we discussed this last week, root of the problem, like why it's happening. And then in business, when you ask the question why 5 times, you should have an answer. You should have the real answer. So you ask why this is happening, they give you some excuse, and then you ask again, and then they give you some excuse. 3rd time and then 4th time, but the 5th time you should get an answer. Mm-hmm. So and when you look at depression, which actually next week we are going to discuss with Dr. Carlo Valencia at our United Medical ACO event, depression is a big problem nationwide. In the world it is, but especially in our nation here in the United States, it's doing worse than the rest of the world. Yep. The depression in youth population is big, and then I can just tie it into the morbid obesity very easily, because depression is not just happening by itself. Depression comes from different elements, different illnesses. It's kind of like the impact of other stuff that's happening around you. So if you're not addressing those problems, how we discussed last week, like if you don't take care of the morbid obesity, and if someone has uncontrolled diabetes and hypertension, well, that's not going to go away. Like the sleep apnea, like it's not going to go away if you're not, if you don't lose weight. So you can't really, you can't heal the sleep apnea, right? So you have a treatment for the CPAP, but then you're not actually treating the problem. So then you may end up having the CPAP and not losing the weight, and then keep doing that for the rest of your life. Versus, let's address the issue here. That issue is the root of the problem is the obesity. So then obesity actually takes it to depression, takes it to diabetes, takes it to sexual dysfunction, ED issues, menopause, weight gain. It's just like the whole thing is all together. So if we understand what happens, then I think you just said you used that term silent.
Suffering in silence, yeah.
Suffering in silence. So that's actually that's a really great way to explain what this issue is. This is the time of digital health, and we are here. Look, I mean, you did 3-4 surgeries today, and then you are here 3 p.m. Just to talk about this. This is a free event, so like this, everyone can watch this.
Absolutely, right? Absolutely.
So then we have to. I think it's our obligation to make this available, and then those people who are suffering in silence, they can actually learn from it.
Absolutely. So, I mean, clearly, in our society, sex is a taboo topic, right? But it is there is a serious issue here, right? You mentioned depression, for instance. There is absolutely no question that there is a clear correlation between prevalence of depression and morbid obesity. And many studies have shown that, right? And it is no surprise because morbid obesity makes the person feel bad about themselves. And depression, the bottom line about depression is that to have a really negative outlook about things, lack of self-confidence, lack of socialization, right? Isolation, right? And suffering in silence, like we said before, right? So all these issues happen because the quality of life with morbid obesity is down. And part of the expression of quality of life, as you said, is having a healthy sexual life. If that is not happening, that is going to impact the emotional health of that person. And that's how depression is going to be expressed, right? It's not uncommon, Kemal. It's not uncommon. If you and I were to look at our database, at the illnesses that morbidly obese patients have, right? We would see that there is a very high prevalence of depression. And as I said, this has been shown in studies as well, right? Now, why, for instance, when you and I look at and talk about how insurance companies, are an obstacle very often in terms of not allowing people to have bariatric surgery. For instance, a person who has a body mass index of 37, right? They say, for you to look for bariatric surgery, although you've tried all diets in the world and you failed, your weight has to go up by another 25 pounds for you to qualify. Or you have to have high blood pressure, or you have to have diabetes, or you have to have sleep apnea. Well, how about depression? Why isn't depression considered a comorbidity of morbid obesity, right? Of obesity, right? Because clearly obesity is having an impact on the mental health of that person. If that person is seeing a counselor, if that person is taking medications for depression, and part of the reason their depression is so entrenched is because of their weight, why not help them to get rid of the weight, right? So the way we look at mental health, of quality of life, and the way we minimize its impact on the health of the person also is an issue that we see all the time. And of course, part of the reason people suffer in silence with this is because there is not an echo that responds to their ailments, right? There isn't really an outright discussion on these issues that tells them, yes, you are right, you're suffering, and help should be gotten to you.
No, absolutely. I think that's the clinical discrimination, I call them. Yep. So the way that you are not heavy enough. It's just like what we are telling the patient. Your BMI is 30, so go home and then gain 30 pounds and then come back. So you qualify. Like this is just like oxymoron. Like that's. But that's how the system works. But then that's why we are also here, because we are game changers. So we are going to change that, right?
Of course.
So tonight we have our company Christmas /holiday / whatever anyone is celebrating party. So end of year party. I know you are going to be there.
Absolutely.
So hopefully everyone will have fun, and then everyone will be there and safe. And we'll be back next week. We are going to discuss the intermittent diet next week.
Great. So
I started mine again. So hopefully I can report some good stuff.
Absolutely.
And
Absolutely.
Small changes do make big impacts on a regular run and on day-to-day run. And we do want to share those. Well, thank you for joining us, and we'll be back next week. Have a nice day.